Good afternoon, everyone. It gives me great pleasure to welcome you all to Ability Centre for this special announcement. Ability Centre is an internationally renowned, innovative community hub focusing on improving outcomes related to health and well-being, social inclusion and economic participation for people of all ages and all abilities. We serve more than 150,000 visitors each year, helping people of all abilities pursue their goals. And in our Inclusion Incubator, we are developing evidence-based programs and services and bringing our model to life across the province and across the country. Through our partnership with the Government of Ontario, we are delivering local impact while co-designing programs and services that are scalable to meet the needs of communities across the province. We look forward to continuing our work together to advance the health and well-being of all Ontarians. Today, I have the distinct honour of introducing the Honourable Christine Elliott, Deputy Premier and Minister of Health, to share some exciting news for Ontarians. Please join me in welcoming Minister Elliott.
Well, thank you very much, Stuart, and good afternoon, everyone. It's always great to be back in Whitby, but I would say especially today because we're here at the Ability Centre. It's great to be here with all of you and alongside my good friend and colleague at Queen's Park, MPP Lorne Coe. For years, MPP Coe has been a strong advocate for better post-stroke care for patients in Durham and across the province. Thank you so much for joining me here today. I would also like to thank the Ability Centre for the warm welcome and Ontario Health for their hard work to coordinate and connect care for patients every day, but especially during the pandemic. From day one, our government has been committed to building a stronger, more resilient healthcare system that ensures all Ontarians have access to the care that they need. Every year, more than 25,000 Ontarians experience a stroke, and there are currently 300,000 people living with the consequences of a stroke. We know that most stroke patients will require access to interprofessional stroke rehabilitation specialists. However, access to these services and these specialists varies across the province, and patients are often left to coordinate their own care. We need to strengthen our healthcare system to ensure that everyone has access to care and the best chance to improve their health outcomes. That's why I am very pleased to advise that our government is investing $5 million to establish a new comprehensive community post-stroke rehabilitation program for adult stroke patients of all ages. This year's initial investment will be followed by ongoing investments in the future to ensure that all Ontarians have access to the high-quality post-stroke care in their community that they need. Working closely with the government, Ontario Health will assess the current state of community stroke rehabilitation services across the province. That will help identify immediate opportunities to improve access to coordinated post-stroke care. In this first year, up to $1.6 million will be used to support patient services to make community programs more accessible to more Ontarians while also building on best practices. I do want to thank everyone who has worked hard to support stroke patients on their journey to recovery, and I would especially like to thank Mr. Jim McEwen, who is here today, for his tireless work as an advocate over many years. Thank you so much, Jim, for your work. So together, we are building a more connected, stronger, more resilient healthcare system for everyone. So thank you. And now I would like to welcome my good friend and colleague, MPP Lorne Coe, to please say a few words.
Well, good afternoon, everyone, and thank you, Minister, for the introduction. It's certainly been a journey to get to this pivotal point today. Jim McEwen told me when I was considering the development of a private member's bill on this matter how he first spoke with former member of Provincial Parliament John O'Toole, who also became a great advocate on this issue. Then the Honourable Christine Elliott tabled a motion while a member of the official opposition unanimously adopted in the legislature what called on the previous government to find the necessary in-year savings to ensure that Ontarians receive the care they need when recovering from a stroke. The actions of these outstanding parliamentarians, as well as the advocacy of Jim McEwen and others from other parts of Ontario, are what led to the development of Bill 9, my private member's bill, which received royal assent when I served in opposition for 2.5 years. What's clear, ladies and gentlemen, is that every area of challenge gives out a ray of hope. And the one unchangeable certainty is that nothing is certain or unchangeable. Today, our government is giving thousands of Ontario stroke survivors a hand up who have been struggling to make it all the way back. Clearly, our young adults are Ontarians' future. And today, because of our government support, they'll be able to participate fully in their community's social and economic life. Now, the late President John F. Kennedy once said, "One person can make a difference, and everyone should try." Everyone should try. Thank you, Minister Elliott, for being that difference in the lives of post-stroke recovery patients here in the region of Durham and other parts of Ontario, lifting up the hopes of so many in our great province. Minister, today you have truly made a lasting difference in so many lives. Thank you for that. Now, it's my privilege to invite a great advocate on this particular issue, Mr. Jim McEwen, to the podium to share some words with us this afternoon. Jim, please join us. Thank you.
Thank you, Lorne. I hope I can be heard.
Jim, would you like to go to the side just a little bit? Just to the right-hand side? Jim, could you just come from the outside of the podium, just to the right, so they can see you? Or to the mark here, Jim? Just here. There you go. Do you want to just roll over to there? I can get your remarks.
Maybe I'll...
Over just on this mark here, Jim, would be great. You got it.
Thank you so much, Lorne, for that brief introduction and your comments. And well, today is a very important day for us. When today's announcement is implemented, our stroke survivors of all ages may have the opportunity to recover to their best potential and possibly return to work or continue their post-secondary studies. And that's an important word, continue their post-secondary studies. But it's also important to note that each stroke recovery is very different. But today's announcement is very monumental for young adult stroke patients, and the next key step is implementation, which I'm happy to hear is on course. Thank you, Minister Elliott. Again, I want to thank Minister Elliott, her minister, and Ontario Health for this significant commitment today. I also want to thank MPP Lorne Coe of Whitby for getting the ball rolling on this subject with the passage of his Bill 9 in 2016. You know, Lorne, I believe that our friend Christine Elliott is the only health minister in this province who's actually followed your Bill 9. I'm sure you'd agree with me on that. It's safe to say that this journey has been a long one at 12 years, and hopefully we are closer to seeing this file cross the finish line. It's been a long 12 years, but persistence pays off. On a personal note, I want to thank Christine Elliott for her many years of public service to Ontarians, and please enjoy your well-deserved retirement. Thank you so much to everyone who has helped in the preparation of today's announcement. So I'd like to ask Stuart McReynolds, President and CEO of the Whitby Ability Center, to please come forward for some closing comments. Thank you, everyone.
Thank you, Jim, and congratulations on your continued advocacy, Jim, and thank you, Minister, for the very exciting announcement today. Ability Centre welcome and applauds the announcement today. Research and evidence show that stroke patients need to continue with community-based exercise and education programs after leaving the hospital as part of their physical, cognitive, and emotional journey to rehabilitation and recovery. Although best practices recommend that individuals recovering from stroke continue with community exercise programs to reduce the likelihood of another stroke, we know that many individuals experience a gap in service, as they may not have access to such a program in their community, particularly for younger stroke patients. We also know that supporting transitions in care along the stroke recovery path are often challenging for healthcare professionals when there is limited or no availability of community exercise programs for those recovering from a stroke. Although following at-home exercise plans may be beneficial for some patients and families, we also know that this puts an even bigger burden on caregivers and family members who are often already experiencing caregiver burnout. There is a significant need to expand exercise programs, such as the Together in Movement and Exercise program, and education programs like Living with Stroke in communities across Ontario. These types of interventions motivate individuals to leave their homes, to connect socially, to establish structure and routine, to advance personal growth and development, while also supporting and influencing others to accomplish similar goals. Access to community programs gives individuals the strength, education, and confidence needed to manage daily activities at home, while improving outcomes related to quality of life. We are encouraged and thankful to the Government of Ontario for its investment in post-stroke community programming, and we look forward to continuing our work with our partners and those with lived experience in meeting the needs of those recovering from stroke. Thank you. And that concludes our remarks today, and we'll open up to any questions. Thank you.
We'll now take questions from the media. If you have a question, please line up behind me. And as a reminder, it's one question, one follow-up. Thank you.
Mr. Elliott, hi, I'm Fraser with Global. I have a question here for my colleague. Last week, the Premier spoke about Dr. Moore's whereabouts and said he was working around the clock. Now, we now know he was on vacation. Many aren't discounting the need for time off. Of course, he's been working hard on everything, but the issue is more about the transparency. Why was it a problem last week to just say he was off on vacation?
Well, because Dr. Moore has been in constant contact with his office, he had an acting Chief Medical Officer of Health in Dr. Murdy and 5 assistant Chief Medical Officers of Health on staff. They have been apprising Dr. Moore throughout this time of the state of affairs in Ontario with the numbers of COVID cases, hospitalizations, people in intensive care, and so on. And of course, he was out yesterday speaking about the antivirals, making sure that we have enhanced eligibility and enhanced access. And that is something that's really important. It's a very important tool for us as we continue to fight COVID, along with our immunizations and our increased hospital capacity.
Yeah, so I guess there is a little bit of criticism, of course, around the transparency of why didn't we just say he was on vacation? Wouldn't it have been just easier to say it up front instead that, okay, he's on vacation and this is why you don't see him?
Well, this was a planned time away for Dr. Moore. However, Dr. Moore has been, as I said before, in constant contact with the people in his office, making sure that things are happening as he wanted them to. And of course, we're waiting his recommendations as far as further masking, for example, whether that will be required post April 27th in hospitals, long-term care homes, and other places of congregate living where we have some of our most vulnerable Ontarians. Thank you.
Thank you.
Hi, Minister Elliott. Adrian from City News. Following up on yesterday's Dr. Moore's press conference, he was asked about temporarily reintroducing masks in school settings. One of the reasons he gave for why he's not doing that was rapid tests, and he said, I quote, use the RATs. The tests are distributed on a weekly basis to students across Ontario. So I'm curious, as the Minister of Health, do you believe that rapid tests are distributed on a weekly basis to students across Ontario?
Well, perhaps I can clarify that. There are 7 million tests a week that are being distributed to local school boards, and school boards will then determine to which schools those tests should be sent. In areas where they may be concerned about a potential outbreak, maybe a number of situations they have concern with wastewater levels being high and so on. So it doesn't happen with every school, but it is up to the jurisdiction of the school boards to make that determination. But there are those 7 million tests going in addition to the tests that people can obtain from pharmacies, grocery stores, and other locations across the province.
Okay, so I think that's a note. So they're not necessarily going to every student each
Yes.
week. Okay. Perhaps you know there is a vote tonight in the city of Ottawa. There's votes in Halton and in Hamilton. School board trustees are taking it upon themselves to vote to temporarily reintroduce masking in schools. If that vote passes, what's your reaction as the Minister of Health?
Well, I would ask people to await to hear Dr. Moore's recommendations. He is taking a look at the situation with our most vulnerable people about wearing masks post April 27th, but he's also reviewing the data to determine whether masking should be reintroduced in public settings, in schools, and so on. So I believe it's a bit premature. I would ask people to please wait until we've heard from Dr. Moore on this subject.
Thanks, everyone. That will conclude the media portion of today's announcement, and now we will take a group photo.